So being a visible minority, growing up in the medical community, you often felt like you had to play the part. You had to show up the way people expected you to. So that lack of authenticity, I think, was draining, if I'm being honest. And I think as I got more comfortable in my own skin and seeing the impacts of diversity and the need for diversity, started showing up more as myself. And that has been a big pivot for me. It's allowed me to show up in the best form that I could show up in. And that's better patient care, more innovative thinking, being more of a true leader. So I think that's how I've viewed representation over the years and how it's shaped me. So I think what it really looks like is optimal patient care. And I think when you have a diverse group of clinicians, when you have a diverse group of leaders, you are allowing yourself to provide the best care and most compassionate care for your patients because you have that shared experience. You know what it's like potentially to be in their shoes. And so when they come with a problem or when they come with something that's causing them a ton of angst, you have that different perspective. And so I think realistically having that lens of diversity as an organization, you have less blind spots and you can provide more compassionate, fulfilling care for your patients. I think just being open and just recognizing that diversity is important and knowing that a lot of your colleagues, especially mid to late career folks, they've had to go through a lot to get to where they are. And so having that level of understanding, having that lens of compassion, advocating for your fellow Black physician and colleague when there's a time of need means so much. And so just being an ally, it doesn't have to be complicated, but just being a supporter. What I'm seeing about from the next generation of docs is they're appreciating the need for a more balanced life. So I think they're going to really address that wellness side of having a work-life balance. That's one thing. And then the other thing that I see is that they really, really are open to new ideas, innovative ways of approaching healthcare. It's not as dogmatic as when I was going through. And so that innovation and that open-mindedness, especially in a time in healthcare where there are a lot of problems and we need to be thinking outside the box, to me, the fact that they're so open, it's bringing me a lot of excitement.